Hello and welcome. Thank you for watching this presentation. This diagnostic download is on kidney cancer. Types of kidney cancer include renal cell carcinoma, transitional cell carcinomas of the renal pelvis, and renal sarcoma. Renal cell carcinoma is the most common type. According to the NIH SEER statistics, kidney cancer accounts for 4% of all new cancer cases, 2.3% of all cancer deaths, and is the 8th most common type of cancer. The median age of diagnosis is 64 years old, and there is a 75.6% 5-year relative survival rate. Some of the factors that increase the risk of developing kidney cancer include smoking, obesity, hypertension, chronic renal failure, chemical exposure, kidney transplant, previous renal cell carcinoma diagnosis, and a family history of renal cancer. Some of the signs and symptoms of kidney cancer include the presence of blood in one's urine, back pain, flank mass, fatigue, weight loss, anemia, fever, and high serum calcium levels. There are several treatment options for kidney cancer, including active surveillance, ablation, surgery, and immunotherapy. For patients undergoing active surveillance, imaging and assessment of renal function is performed every 6 months for 2 years, followed by annual screens. Signs of complication or disease relapse following a partial or radical nephrectomy can include cachexia, anemia, or an elevated platelet count. Common immunotherapy side effects include rashes, flu-like symptoms, and stomach issues. These are just a few clinical implications of the various treatment options for kidney cancer that may be identified by a physical therapist in the clinic. Physical therapists working with patients with a diagnosis of kidney cancer can work to educate, screen, and intervene. PTs can educate patients on the role of physical activity in decreasing risk of developing kidney cancer and utilize motivational interviewing to address modifiable risk factors. PTs can screen patients for signs and symptoms of kidney cancer, as well as post-operative complications and treatment-related side effects, and make appropriate and timely referrals. PTs can identify and treat patients' treatment-related impairments and utilize exercise for the management of symptoms like cancer-related fatigue. Lastly, PTs can educate patients on the use of physical activity to decrease mortality risk in renal cell carcinoma survivors. PTs can educate on the role of physical activity in decreasing risk of developing kidney cancer. PTs can educate patients on risk factors associated with kidney cancer and address modifiable risk factors within scope of practice. PTs can screen for signs and symptoms of kidney cancer and make appropriate and timely referrals to a physician. And lastly, PTs can educate kidney cancer survivors on the positive effects of physical activity for decreasing overall mortality risk. These are the resources that were used in the creation of this presentation. Thank you for watching.